Hi, my name is Jay. I've had this condition for about 5+ years.
It's annoying to have something like this, right?
Like I'm self-conscious to wear anything that shows my back. The cyst is part of it, but my back skin is just in general not good.
There's an issue of scarring, certainly, bleeding, of pain, of infection.
I actually kind of did a mini surgery on my body. One of the most satisfying thing I've ever experienced in my life.
That's what's scary to me, to think that people are taking their cysts into their own hands.
And that particular cyst, it's still kind of half there. I learned my lesson.
If you don't remove that sac, like the little balloon there, it will keep growing back.
Hi, my name is Jay. I'm located in Vancouver, Canada. I've been living here for the last 15 years, but I'm originally from northwest China. I've had this condition, which I suspect is a cyst, for about 5+ years. Started small, but it started to gradually grow into the current size. Still not too big, but starting to visibly shown and started to bother me. This one is gotta be professionally removed. I've done similar things before. I've actually successfully removed one other cyst on my body. I'm not proud of it. I know it's not the proper way of removing it, but I did squeeze the content out. It's probably one of the most satisfying thing I've ever experienced in my life. However, it wasn't clean, so it kind of like went off for a few days, but eventually kind of healed on its own. And that particular cyst, it's still kind of half there. So I'm like constantly monitoring it, knowing that it wasn't completely cleanly removed. And I learned my lesson.
I think that the main thing that would prevent you from removing something yourself is if you don't have anesthesia. I mean, it's very painful, especially if something's already inflamed, it's already really super sensitive. So to try to remove something like that is very difficult. I will say though, when you have an inflamed cyst, you want to actually do what's called an IND, an incision and drainage, to relieve the pressure. It actually makes it feel better, but you don't stitch it up, you leave it open. But in general, I'm never going to recommend that anybody removes their own cyst. I think that there's questions for, there's an issue of scarring, certainly. There's an issue of bleeding, of pain, of infection.
I'd say it's more psychological burden than a physical one. It causes me to be a little bit more self-conscious in the summer. My sister growing up was like the #1 pimple popper for me. And when we get together, we would still sometimes shut the bedroom door and just like squeeze pimples out of each other. So she's been a big supporter. She is thrilled that I'm going. This is a very vulnerable and intimate thing. My husband, it took many years for him to reach the status to be able to pop my pimples. And he finally was comfortable doing it. I was finally comfortable letting him doing it, more the latter. And he will be coming to LA with me. So I have my travel buddy and surgery support. I'm very excited obviously to get it removed. But I'm more excited to meet Dr. Pimple Popper. I'm gonna be starstruck and I might be shaking as she operates on me.
Hello, hi, how are you? Jay, nice to meet you. I'm Dr. Lee, welcome. Okay, so you have a bump, it looks like on your neck or something?
On my back, like just below the neck.
How long have you had this?
At least 5 years.
Okay, you can relax it, don't push on it. Yeah, it feels like you got probably a little cyst there. But you get little pimples every randomly, it looks like on your back too, yeah, so you may be prone. I see that she has a history of acne breakouts on her back. I can see a little post-inflammatory hyperpigmentation.
I typically have a lot of similar skin issues on my body, and I found that a lot of them are actually caused by ingrown hair. So start with ingrown hair and things start to get swollen around it. And whenever I see a bump on my body, I know there's got to be some underlying reason, typically a hair trapped, and I always squeeze it out. And typically lives like a dark mark, so I have quite a few dark marks on my body because I tried to remove things, blackheads and cyst looking things. Like I'm self-conscious to wear anything that shows my back. The cyst is part of it, but my back skin is just in general not good.
People can have cysts and they can have cystic acne as well. They kind of are more commonly related to each other.
It's annoying to have something like this, right? They're called epidermoid cysts. That's what I think this is. It's a benign growth, like a balloon of skin. Like it's almost like your skin gets tucked underneath. And so now when your skin normally sheds, it sheds into this sac. There's nowhere for it to escape, like our skin might shed on our body. If you don't remove that sac, like the little balloon there, it will keep growing back. So I think it should be pretty straightforward for us to remove this. Cysts don't directly run in the family, but I think it has a lot to do with the skin type that you have. If you have more of an oily complexion, there's good things with that and there's bad things with that. Sometimes oily complexion can lead to more cyst formation, but I wouldn't say there's a direct correlation. I mean, cysts are common in general. They can happen in pretty much anybody. Is this your first cyst?
No, it would be like my second, I guess. And I did, incorrectly remove one at another part of my body. I feel like I've got enough education from you.
Oh, okay.
All these years.
That's what's scary to me, to think that people are taking, their cysts into their own hands.
It did get inflamed.
Sometimes when it gets inflamed, sometimes your body does get rid of the whole thing. It sort of breaks down that sac wall.
Yeah.
So hopefully that may happen. This is an excellent time for Jay to remove her cyst because we want to remove it when it's really quiet, when it's not angry or inflamed. It's harder to remove a cyst when it's inflamed. It's not very well defined. It's partially broken down and liquefied, so it's very hard for me to make sure that I got the entire cyst. Sometimes it's not even like it's open to the surface. It's like maybe it got hit or something. It breaks open. Before that, your body, your immune system doesn't even realize that it's there. It's just kind of letting it coexist. But if it were to break open a little bit and sort of expose to your inside of your body, your immune system starts to perk up and go, wait, what's going on here? There's something happening here. Let me destroy this enemy. So like all of your army of your macrophages and your neutrophils and all your like immune cells try to go and attack it, and that's why it gets inflamed. And that pain that you get from it when it gets swollen is actually due to the stretching of the skin. It like pulls on your nerves and it makes it very sensitive. But I just wanted to tell you, it is a lot like the videos that you watch. The most important thing is you in it. Did you say that, is there somebody with you too that wanted to watch?
Yeah, my husband.
Oh, okay.
See, there's a little pore right there. I just wanted to make sure that you've never squeezed this one. I just want to put that. I like to look for an opening, because then I know, because I want to try to remove that.
The procedure went great. She had more of a gray-brown to her epidermoid cyst, to the contents there. And you never know, sometimes these cysts are easy to sort of extricate from the body, but this one was kind of stuck to her, and the sac wall was rather thin, so I had to sort of kind of tease it out in pieces. And it was kind of liquefied. It might have just been the numbing that I put in there that sort of like maybe made it wetter, or else it was just a little bit partially broken down there already. It was a pretty straightforward cyst, and that we got it all, and it shouldn't come back.
So my physical recovery of the surgery is super easy because Dr. Lee did a great job in making the smallest possible clean cut. So I barely felt anything afterwards. From a patient's perspective, I'm just so impressed by Dr. Lee's expertise and professionalism. She mentioned during the procedure that she didn't want to do a whole pop because that would require a bigger cut. The popaholic me would definitely want to watch a dramatic pop with the whole thing coming out, but she had my best interest in heart more than I did. The physical difference is obvious. The lump that I had is gone. I can't feel it, can't see it. More importantly though, I feel is the psychological shift. Something skunky that got under my skin, literally, is gone. I don't have to deal with the uncertain feeling of how it might grow bigger, or would it grow to be a non-benign thing. And I'll also don't have to experience the slight, nothing crazy, but slight dim of confidence when I wear a tank top. It is just a nice feeling that I can move on from this minor but constant inconvenience in my life. So I'm just super happy that what needed to be popped is popped out of my life. Thanks, Dr. Lee.